It is Wednesday, and I love your background, Jim.
You like it? It's the real. It's the backyard.
No, it's the virtual one.
No, that's it. That's my actual backyard. Look.
Oh, wow. This is amazing. Nature. I'm gonna have to do the same next time. Yeah, mine hasn't changed much.
Yeah, I don't disappear if I move around. You know, it's not one of those.
I,
Like it goes away. What's the best virtual background you've seen in the bazillion Zoom conferences you've had?
so honestly, I haven't seen anything that funky or crazy, but there was a tweet going around. There's a guy that basically created a background of himself serving himself coffee.
Oh, yeah, I see that one. My son jumped on
It's
that
been
one. That's pretty nice.
that was hilarious. And then actually my brother commented saying, how do we know he doesn't have a twin brother, that guy, right? So, you know, always question things. So first of all, I want to say we finally have our first critic. I saw a comment on one of the posts saying, nothing was said in the first 3 minutes. My first of all, great that it was only 3 minutes. But secondly, my cup is always half full. That means the other 27 were full of information.
Right. We must have said something at some stage. I think that that's policy.
But it's good. Word of mouth is working. So latest quick stats. And without further ado, I see our guest knocking already.
Yeah, we should say the name of the podcast in our names. We should do that as policy. Introduce ourselves in the name of our podcast each week. No?
Oh, damn it. Yes. I'm Eugene.
I'm Jim. Shot of digital health therapy.
Yes. And no bad words allowed. Did you bring your C19 card?
Yep, I got the C19, and I've got C19, and we're on our what episode?
I lost track. 6, I think.
Fifth
episode. You know, yes, but 6 recording. So we have it says 1K plus impressions. So I guess we're waiting for 2K now as the next top. 48 subscribers, so 48 people actually press ignore when YouTube pops them up with a new episode, which is great.
I had someone approach me this week, a very influential guy, to try to offer you a job.
I'm not for sale.
I didn't think so. Nor saleable.
Ask my real boss, Marina, the CEO of Your Coach. A few more things. Podcasts up 25% of the download, so we're up to 125. And the greatest news, we've been included as part of a newsletter. Thank you, Jorge Gonzalez at TIC Biomed. So without us knowing, we're part of it.
We're proper. We're kind of climbing ourselves the way through the.
So like I warned you last time, right? I mean, again, just to kind of level set, this was meant to be kind of just people chatting at the bar. And a lot of times you're kind of in your own groups of people that you know. Right. Well, our next guest, Roberto Ascione, I know you've come across him, but I never dragged you along to really get to know him in the bar. So I will now admit him and introduce you guys. So Roberto is CEO of Healthware Group, amongst many other titles, and been driving the digital health ecosystem really also all around the world, though his focus has been in the original epicenter where the bad stuff broke out. I stayed away from your card, in Italy. So let's get him in.
Check in with him. And he's the chairman of Frontiers, right? Or is that correct?
Yes, also chairman of Frontiers.
Roberto.
Hey, guys.
Hey, Roberto.
Good to see you.
Good to see you guys.
So I just quickly introduced you, Roberto, as CEO of Healthware Group, and Jim reminded me that you're also chairman of Frontiers, and so many other things. But you know, the interesting part is, as you guys kind of came across each other, the premise of this digital shot of therapy. Forgot our name of the show, Jim. Like, oh man. The whole point of it is like, it was supposed to be just kind of like people chatting kind of at the bar, but taking this recording, and you know what happens at the bar? Hey, I know Roberto. Hey, Jim, come meet Roberto. So Jim really meet Roberto. Roberto really meet Jim. And
Roberto Piacere.
Great. So guys, so great to get together this evening.
Yeah, so Roberto, so I know you through Eugene, through Martin Kelly. You're kind of a famous connector, the two famous connectors. I remember both the guys being really excited. I think first meeting you, you got to meet this super digital health connector, investor, company builder. So maybe just for the maybe a quick little bio, if you wouldn't mind.
Yeah, happy to. I'm involved with all things digital and healthcare since now more than 20 years. I originally studied as a doctor, but I was passionate for computer science. So I was coding as, like in my spare time, I was studying as a doctor. And then I realized back then, which now is like, wow, like probably more than 25 years ago, that, by writing software for doctors, impact might have been much bigger than just being one single doctor, dealing with, his own patients. That was my idea. And at the time, it was like, was not getting any traction. Nobody was paying attention to it. So what you do when you are 24, 26, and you have a dream and nobody cares, you basically, today, you build a startup. At the time, I was building a company, right? Okay. So, and then I started to take on medical records, those kind of things obvious to me.
Yeah.
And then my first company was born. Then I founded one of the very first European the digital zero companies back then.
What was the name?
And it was called simply Health World Clinical Research back then. And then I basically created another company which was dealing with medical education and marketing communication for life sciences companies through digital. And that was the one that really took off. Got acquired by Greek Group. I moved there, so I lived about 10 years as a global manager. I mean, I ended up in a global role as global president for this group. I did all my M&As, expansion to multiple countries. And then the most exciting part, as of 2015, I joined the Healthware as you know it today as full CEO. And the investors behind us do believe in this vision of this digital health future. So a future of healthcare really based on digital health, which is basically what I'm doing now. And so basically today we do keep helping large-scale companies go digital in the life sciences space. And we run Healthware Ventures, which does invest in early-stage startups. And the third and last thing we do, we try to connect large-scale companies with startups in a meaningful way to get going with projects much faster, much more relevant for patients and physicians. So that's 23 years in probably 3 minutes.
I like the meaningful way comment, because that's important.
Yeah. Well, we do a little check-in. So you're our first, other than I'm based in Dublin, but I have a East Coast U.S. accent, or I used to anyway. I don't know what I
can tell.
But so give us the insight to Italy. You look pretty chirpy and happy. What's the quick lay of the land? Are you stuck inside? Are you traveling around?
Yeah, I mean, you know that we have been the first to be hit hard out of China. That was like last days of February, 27th. My last physical meeting has been Wednesday, 26th of February in the NIH of Italy. I still remember the meeting.
As an extroverted traveler, you know that date well, I'm sure.
Yes.
Yeah. How's the psyche? How are you finding it? How are you finding it? Are you ready to get out?
Yeah, no, I mean, I literally didn't leave home for more than 2 months. I've been going out like the first days, literally like a few days ago, because we have been lifting the total lockdown as of about a week. And well, we have been working from home with all teams in Italy, but then also in Germany, UK, meeting each other digitally in video every single day. So I met physically a few team members for the first time after more than 2 months, like yesterday, and
Yeah.
strange feeling. It didn't feel this time passed at all. It's been like a gigantic bubble, super fast, you know.
Yeah, it's kind of like vacation, isn't it, Eugene?
Yeah, it's kind of like okay, but I was actually going to ask you. I mean, in Italy, the three kisses, right? Or actually, two kisses the reverse way from.
Right.
When you see your team members, it's like I was telling you, Roberto, like I miss those hugs, right? Like I know in Italy, it's the two kisses. Like how
does that
awkward or weird is it?
Well, I mean, it's something that instinctively you
women
want
are
to
thankful for?
get close. Well, and now you kind of you learn not to do it, so to speak. It still feels unnatural. I hope it stays unnatural, right? I'll be a little bit afraid if it becomes natural not to do it. And not that you do all the time, you might not do in a business setting necessarily. But it's that's one of the things that is changing. Also, have everyone with masks on clearly changes the perception you have around. And but guys, that has been very bad, especially in the north. Several weeks, the sadness was like really unmanageable. So I think we are slowly getting out of this phase one. We are not done with it by many, on many levels. But I think it's already much better because at least we are, trending towards a new normal.
Yeah.
Now nobody knows, but we gotta
right before this all started happening. Won't say the word, Eugene. I wrote a blog post about the impact of the smile. The impact of the smile and how the dopamine hit and the all the clinical research that's out there, and then and then effectively with masks now you can't see anyone smile. So like your kind of the smile's been kind of locked up now when you don't see it. Never mind like physical.
That's very true. We're gonna find a way though, and we will.
You could zoom behind the mask and like show them the smile.
Well, I've seen people printing masks with kind of like a picture of their actual face, but it's imprinted on the mask or something. I don't know where. I just saw that randomly, but
yeah, it's very eyes wide shut, kind of.
Yeah. So Roberto, I know, and I think you and I chatted a long time ago. You've been sort of looking at this very globally, but then when this crisis, so I'm avoiding other words, but I think crisis was not on the list, but you can show the audience what we do when somebody says the word, there you go. When the crisis, you kind of also started doing quite a lot more, inside Italy. And how did you see the ecosystem really wake up to the challenge? So I'm kind of curious again, sort of continuing on with our discussion a little bit on what's been happening in Italy, but also how the ecosystem in digital health has come together. I'd be really curious on your thoughts.
So, I mean, as you know, we work and my role specifically very internationally, but of course, Italy is an important country for us. We have a great team there, which also does international work. Towards the beginning of February, we were also observing what's going on in China, and we started to think about what if this comes over, right? So by any means, I'm saying we were expecting the magnitude of what happened, but we said it might come, and if it comes, what that means, you know, in terms of what we would need from a response perspective, on a digital level, what doctors might need, what patients might need, and also what pharmaceutical companies, you know, life sciences companies might need to deal with. So we started to work on what we then called strategic response model. And this was basically based on trying to understand what signals we were getting, what data we were getting, and playing a little bit fast forward. So saying something like, what if this data would be real or kind of materialize this scenario? What kind of solutions we might deploy, right? So it was a little bit of this kind of exercise. So
scenario modeling.
Yeah, scenario modeling, but in a way that we want to factor digital health companies in this modeling, right? So thinking about fast response, we said, look, it might be interesting that if we started to map companies that might have half of the solution or 3/4 of it, and then might pivot in order to deploy something useful in kind of nearly real time, right? So the first problem we were facing was people would starting to have a lot of questions. How should we cope with this? Is this dangerous? Not dangerous? What should be doing? So we started to work with a company, and it came handy that Italy, you know, we started to see the first kind of issues with this in the country. So we started to work with a company in the country called Pagine Mediche, which we are also investors in, and we basically said, why don't we create a web-based chatbot, basically, which then has been done multiple other times, including CDC of Atlanta, as you have seen, but purposely web-based, because in the beginning, the epidemiological model was not known, it was changing. We had the first red zones. If you remember, you guys were seeing in the news. I was on WhatsApp with many friends around the world that were super kind to check in what's going on there. And it was these red zones, then regional lockdown, and then nationwide, but it was really changing. So we modeled this, and these guys built this chatbot, which was basically helping people to self-triage and then send in the right direction, whether to see the doctor, don't see the doctor, call emergency number, whatever. And then was distributed free in the public domain for all institutions, whatever. And that has been incredibly helpful because thousands and thousands of people triage through that system, and data have been gathered, and this data have been donated to the Ministry of Health of Italy and the WHO with very good results.
Yeah, so like just digging into that, because I always think of like Italy. I don't know, Eugene, did you ever try to implement something in Italy, in terms of a digital health project?
Trying to think, not off the top of my head, but
so I have a great love for all things Italian and Italians, and but I found, when I was implementing our technology across Europe, I found Italy to be one of the more frustrating markets to get into, and it just didn't seem to have a pathway. It just didn't seem to be ready, really ready to start adopting. Other markets similar in some ways, but I definitely found it. Is that all changed now? Is this company, for example, it's one thing you gave it out for free, but does it now is it going to break at like a lovely, long-term business model for this company, you think, in Italy, not elsewhere?
Sure. There are a couple of issues, there historically to roll out and scale digital health solutions, which is first, health is managed locally, regionally, and there are basically 20 different systems. So there is a Ministry of Health that gives like a roadmap, but then it's truly paid, regulated, reimbursed at 20 local. And when you take these 20 systems, it's not that one system is 60 million people. It's much smaller. So in fact, there are a couple that have 2 or 3 that have enough sites. Others are rather small. So it's
Okay.
pretty tricky. It's a bit tricky as you probably experience yourself. So that was one. And the other one is that but aside of this fragmentation, it's also that there's been always a certain attention to this solutions, but probably they haven't been, at least so far, taken as like central pieces to build out.
And has that changed? Is that the case now? Is it, has anything kind of born out of this? Has something been born out of the pandemic?
Yeah, that has changed, is changing.
Calling it on yourself, Jim.
Yeah, that is changing actually, because what basically happened is that during the peak of the pandemic, which is something that probably is helping also in it's happening also in other countries. There's been a little bit of a lift on certain things, right? Like the ability to do drug delivery at home, different things.
Right.
And on the other side, there's been a great attention forced by the lockdown on things like telehealth and remote monitoring and video, consultations and so on and so forth, which were existing before, like this company that I mentioned, but not at scale. So there were little proof of concepts here and there, a little pilots, but nothing really at scale.
Yeah.
So the pressing need caused much bigger and faster adoption. So to give you a metric of that, I released an interview that got titled 10 years in 10 days, because this company got like 5,000 physicians onto the platform in 25 days, which otherwise would have taken 3 years probably, right?
Like the vortex, right? Just
yeah. And so that has been an emergency response that has been able to create, I believe, a tipping point. Now, the rest is yet to be seen. There are two things important there. So first off, will be these really cool experiences, with great metrics, really helpful. These guys are handling thousands of patients at home in safety through the system. So question is, will these guys be able to turn on a sustainable business model, and this will get them rolling for the long term?
Yeah.
Initial response is maybe yes, because I've seen a couple of regions reaching out to them and say, hey guys, this is great. We want to bring you under a contract to make this happen, to keep this sustainable.
Yeah.
So it's not done, but I think at least it's very different than before in the right way. And adoption is there. And I believe, guys, that if with all digital products, if adoption is there, if usage is there, if engagement is there,
you can figure out
what would you do? You will pull it back and say,
cut it
you
off.
find it convenient, it worked, and
Yeah.
then
Yeah.
I don't think so. So I hope at least, we will not go back.
Roberto, so this is, relatively a startup that I wouldn't say pivoted, but certainly took the opportunity to help the society and also speed up some of the adoption. Your core business is obviously a lot of the life sciences companies, and I'm curious what you're seeing, because, as both of you guys know, I exited a large life sciences entity, and things like, virtual clinical trials, digital biomarker discovery, e-detailing, all that stuff was nice. Everybody was talking about, there were pilots, but I feel like, I'm just curious what you're seeing in the wild with some of your clients, especially with the core work that you're doing.
Yeah, that's an interesting one. We have been around since, as I said before, basically forever, right? Starting with the first disease awareness websites back 20 years ago.
Your hair is not great, so
yeah,
the hair is great.
I'm jealous every time.
So so we have seen that, like slow pace evolution, so to speak, right? Over time. And of course, a lot has changed over the years with more and more attention to these topics. But to your point, the pilot disease, right, was still very prominent.
Pilot.
Like the pilot disease.
Yeah, yeah, it's a disease at the end, right?
Yeah, so almost a pilot pandemic. Yeah, no, it was by design.
I think you got to do it again. So what changed is what was seen as a midterm or long-term, change management exercise towards a foreseeable, maybe to happen future to an extent, right, has become something that, we're gonna do it, and we're gonna do seriously, we're gonna do now. So now we are starting to, first off, we are enjoying a number of brainstorming sessions, very open and candid, exchange, which is very, very refreshing. I have to say, a lot of people have been taking this very seriously in a number of life science companies globally. We are enjoying having discussions with. Something has already started. I think much more will start soon. What I think it's really interesting is I'll make two examples which I believe will be kind of clear. So first off, we are starting to discuss in real terms about agile way of working versus waterfall, which for a large scale company is not easy, as you know, Eugene, and Jim, you know, too, by other avenues. Basically,
he's a recovering executive, so
I'm recovering pharmaceutical.
This thing inside pharma as well.
I know that. That's why I'm saying. And so the fact that now you can talk agile, you can talk proof of concept in a much more kind of factual way, I think it's conducive to probably better outcome in the future, to stay on the disease side. And then the other thing is, for example, now creating these projects with startups, like 3 ways. So us like acting like a gearbox in between the engine and the wheels, in a way that we all kind of do this together to bring something valuable to the customers, being physicians as an example. I think it's much more real. So I'm really hopeful.
One of the things, Roberto, like I'd be interested, or in Eugene, I'd be interested if you look at like those projects, right? You're always gonna, like if you're doing it in Europe, you're thinking about what country you're gonna go to, like back to the country, like what countries. Like when you look like just in a quick fire way, what's your top 4 countries, like Eugene? What's your top 4 countries that you would implement a digital health project?
4 is too much. I mean, I usually ask the question.
What's your top 3? What's your top 2? What's your top 2?
I would actually pick. I mean, I think honestly, U.S. just because I'm studying here, and I think there's major shifts, and probably the most challenging leadership. I'll put it that way. Shit, you asked for 4. I can't even think of 2 that I would actually pick right now.
Okay, so you just go to the U.S.
I'm here. We're focused with your coach in U.S.
Hey, Roberto, what's your top 4? What's your top 4? We'll go back to you if you come up with one.
I will use the first one, not necessarily in order, but the first one, U.S. as well, because of sites. So I'm left with 3. Germany, I think it's very interesting. The regulation there has changed, as you guys know, and it's very interesting to look what unfolds there. So that for sure. I would also, if we are limited to Europe.
No, anywhere in the world. U.S. isn't yet part of Europe.
I was saying, besides U.S., China is of course extremely interesting. There are dynamics there.
Coming out first.
What?
They came into this first, coming out first too, right?
Right. So okay, so I got it. So it's U.S., China. Where'd you say? What was the other one?
Germany.
Germany.
And then I tell you, there are some interesting models. I think France, Italy are coming up as interesting.
Okay, France and Italy.
Test markets. Because now they are, they decided to invest in healthcare. And I believe there is a certain level of, I think there's a certain level of understanding that digital, it's an integral piece of the future state. So it's early, but I wouldn't undermine one of those markets.
Yeah, like I'm like in the US, I have mixed feelings about you kind of have to be there, so you almost have to have it on the list. And then I feel like I feel like your shots are it's Netherlands. I think Ireland. Obviously, I'm here in Ireland for trying stuff. Definitely Germany. If I had to throw something else in there, it might be Sweden. That would be my like tryout markets, not my scale markets necessarily.
I'll do a cop-out answer. 188 countries, pick one.
right.
Top 188, please.
No, I think it's interesting. Where do you try stuff? Like, you're doing these things. Like so I go to people and they all have different views. Like in my company, we got traction in Ireland, Portugal, Netherlands, and Belgium. Became very big markets for us.
We're honestly we're this virtual bar, right? And I think the reality is, we know this as entrepreneurs or serial entrepreneurs, it's kind of hacking away at everything from relationships to the systems. Yes, there's a mission, vision, but there's also being opportunistic. And I actually think this world got even flatter in a sense, right? As we're all home now. I think we talked last time, Jim. Physical implementations are going to be challenging, I think. But otherwise, I think the world is all of our oysters.
Yeah.
Right?
Yeah.
You also, Roberto, chairman of Frontiers, which I've enjoyed in person in wonderful Berlin for a couple of years now. And let's see what happens. I think original date sometime in November. But I'm also looking forward to, I think, our Friday. I hope it's Friday, at least it's in my calendar. So I'm kind of curious what I'll be there, don't worry. I'll make it. I'm sure it's on my calendar. So I'm curious kind of what's your agenda, because I haven't been prepped for my panel. Didn't even look that far. So I'm hearing this first from you here.
Great. So that's one of our Mr. Panel moderators.
Yep, I'll be there.
So
he's good on his feet.
It's a bar after all, right? So the Frontiers Health, it's the conference I'm chairman for, which happens in Berlin, the global version at least, and then you have like the fast tracks, single day events are all around the world. So this year we are fortunate to do San Fran around the JP Morgan. That was really cool, but then was left the only one that we did in person because Barcelona was canceled, Croatia during the Health Week, Europe was canceled, Milan was canceled. So we're not sure yet about Berlin. We are hopeful could happen in person, but at the same time, and that will be in case the 14th and 15th of November. And honestly, if we won't be in person, we'll be live. Okay. So to get ready for that, this Friday, we are doing the first time a Frontiers Health Live. So this will start at 4 p.m. Central European time. We will have people from Far East to West Coast, and we will go on till 11 p.m. Central European time. Is a very big POC of this. It's not just a webinar. It will be a mixed reality conference. So there will be speakers streaming, of course, but we converted a floor of one of our offices into a virtual events production center. So I'll be on a stage with virtual, component around me, which I hope everything will work out. I'll be, there, and we'll be multicasted on multiple platforms.
CYA, cover your ass comment. So we'll, if something doesn't work.
Just saying. And then I have very distinguished speakers, including yourself, that will moderate a panel that I won't brief you here live because I'm sure you're on top of the prep and have you done all the work behind.
I'll get to that tomorrow evening. Yes.
Yeah.
This is the podcast. He was incentivized to join a podcast called an unproduced podcast. You know.
Yeah. And so on a just a slightly more serious note, the event will be, I mean, the title is Fighting the Pandemic. I said pandemic.
Nice. Roberto, you learned.
Okay. Well, I have to be on the show 6 hours on Friday. I gotta be ready for. So the idea is to discuss about the things we have done during the crisis, what we learned, what data we gathered, and how those things that we learned we can bring with us in the new normal. So it's not to celebrate the reaction to the issue only, at least, but is to share the learnings in perspective. So it's aiming at a new normal. So this will be done through various segments with different startups globally. And there will be also 3 panels, one on the role of ecosystem moving forward in the new normal.
Okay.
Which is the one Eugene will moderate. And then there will be one about investments in the future, right? What's the investment strategies and habits? And then we will have another one about policies. How policies are changing, or how we wish policy should change to help us for the future.
I think one of the most amazing things I've ever seen.
Thanks for the review of the agenda. I'm now informed.
Roberto, one of the most amazing things I've seen. I went to Frontiers, and the way it timed with the policy changes in Germany, it was one of the most amazing presentations I've been involved in. And the way the government was there in Berlin, they were kind of unleashing, you know, as like it was almost like being in the stock market or something, you know, the way it was releasing, you know. So will there be a big announcement at the Frontiers like that of some massive change in the reimbursement system?
Well, there will be a few companies that will unveil for the first time significant clearance that have got new releases. There is a company announcing a product that will be on the App Store as of the Monday after. There will be a few surprises. And I will also be unveiling a global mapping of those companies that we have built, which then will be released on Monday as well. So
awesome.
Let's see. But I especially think we will have fun to gather all together and learn from each other, which is key to every Frontiers.
I just realized I'm supposed to be the timekeeper, and we're like way, you know, the suggested by our viewers was below 30 minutes. We're like almost at 40, I think. And I don't feel like it's a one drink editing. So hopefully this will drive up our average viewing time. So,
we're all about the stats. But they say a bird doesn't fly on one wing, you know?
Exactly. Yeah, the stats, we got to know where we're going, right? And where we've been. So that's a wrap. Roberto, thank you for joining us all the way from Solerno, Italy. I'm jealous of your views over there.
Molto grazie, piacere.
Namaste.
Thank you so much, guys. We'll see you on Friday.